Hello everyone, welcome and thank you for joining us in our Day 2 of Joint Seminar with Healis Autism Center. I'm Yi Ling, a student from SIT Project IncluSGive, and I'll be with you running through the entire event today. So together with Healis Autism Center, we have prepared a seminar for you with today's topic being Acknowledging Autism for Life. Here's a brief run-through of our timeline for today. Firstly, to get to know us better, I'll be introducing to you the team of SIT students and the speakers from Healis. Following that, the first speaker will then share with you on better understanding the signs that your child is displaying. This will be followed by our Q&A session for the first topic. For those who have joined us earlier may have seen the slideshow with steps on how to ask the questions after each topic were explained. For those who have missed it, I'll be doing a quick run-through again in a short while. After the first topic's Q&A, we'll be then taking a short break before moving on to the second topic. So who is SIT Project IncluSGive? We are a service learning group formed by 18 students from Singapore Institute of Technology and are currently in collaboration with SG Enable to reach out to caregivers and care recipients by creating events and activities like this. And with me today are my 4 other team members. Our team's aims and objectives are to provide caregivers with respite, to strengthen engagement with caregivers through events and activities, to provide support to caregivers by meeting their needs, and also to empower caregivers by imparting essential skills to them. So in collaboration with us is Healis Autism Center, who is known to being the most effective ABA, VB treatment center in Singapore. They are also an advocate in neurodiversity and individuality for an individual with autism, with the aim of not only to helping them to achieve normalization in communication, we also strive to help them in reaching their fullest potential in their talents while shaping their character and promoting mental wellness during therapy. 2 speakers will be presenting to you today, with the first topic by Yi Zhuang, a clinical director, and the second by Kara, a senior therapist. So before we begin, here's a quick run-through for the Q&A. We have allocated time for Q&A after each topic, so if you'd like to ask during the Q&A session, you may type down the question in the Q&A toolbox below. So before we begin, some general ethics. Do not use the chat box to chat with either the panelists or other attendees about matters that are not pertaining to this event. And during the Q&A, do ask a question only one at a time and kindly wait for one of our members to facilitate it. In the event if your question is missed out, do inform us via the chat box. And also, because as the time limit, if your question is unanswered by the end of the seminar, do note that we'll be compiling the questions and we'll get back to you as soon as possible via email. Now I'll be inviting the first speaker, Yi Zhuang. Yi Zhuang, may you please unmute yourself, turn on the camera, and share your screen.
Thank you, Yi Ling. And hello, everyone. Thank you for joining us today to learn more about autism. I'm Yi Zhuang, and I'm the first speaker for today. Allow me to share my screen. So the topic I'm covering today will be on some of the common signs associated with autism. And later, Kara will talk about some of the skills that every child should have in order to learn and function independently. So here are some signs that we always hear about and read about. So firstly, the lack of eye contact. Secondly, delayed language development. Stimming, which is
I can't see your slide.
Oh, hold on. Okay. Can everyone see my slides now?
Yes.
Yes.
Sorry for that. Okay, so firstly, the lack of eye contact. Secondly, delayed language development. And then we're going to talk about stimming as well, which is a self-regulatory behavior. Echolalia, repetitive behavior, and some rigid behaviors. So the first one will be lack of eye contact. So what is eye contact? It means the child looking at the person's face. So the way we assess is whether the child is looking at you during instructions, during play, during conversation, or when they're called their name. So why is it so important to to know about eye contact, because firstly, it's social skill. So it's very important to show eye contact so that the other party that we are talking to understands that we are giving them our attention. So it makes it more rewarding for the person who is talking to us as well. So we don't like to talk to people who are not looking at us or attending to us. So eye contact is a behavior to show that, hey, I'm attending to you. So that's why we want to teach every child to have that. So secondly, it's also important because if they're not showing eye contact, means that they're not attending to our facial expression, they're not attending to our lip movements. So if they're not doing that, then it's gonna affect their interpretation of facial expressions and also like their speech as well, because they're not attending to our lip movements and they're not picking up speech in that way. So some of the reasons why a child with autism, they don't show eye contact. Eye contact is something that is natural, with children, neurotypical children. They naturally have it. They know that they're supposed to look. They naturally look when they're called their name. But children with autism, we kind of need to teach them explicitly. So some reasons is that they lack the motivation, so they don't understand that they need to look at you when they are interacting with you. They don't understand that this is a way to show that I'm giving my attention to you. So also the other reason why they don't show eye contact is that they lack attention. So they lack the ability to actually focus on something. And then also the other reason why is that they lack the ability to actually track and scan information. So some of the things that we can do to increase eye contact. So one thing that parents can do is that they can place something very rewarding that the child wants near their eyes or near their face, and then wait for the child to look at you before delivering the item to them. So sometimes, especially during requests, if the child is already able to make requests, the prerequisite before making a request is to attend to you, which is the eye contact. So most of the time when we do that with a child, we are able to increase the eye contact in them. So moving on to the next area, which is the next sign, which is delayed language development. So what is delayed language development? It means that the child may be having very few words or no words at all, or it's not. It can be referring to a child having many words but not using them to communicate. So they're not using their language functionally. So why is it so important? Because we will be able to express ourselves better with words, and that's why we need to have language. So some reasons why a child is not developing language properly is that firstly, so one of the most basic skill that a child should have is the ability to actually attend to information, attend to things that are happening around them. So that would require the skill to actually scan and track objects. So some of the things that we do to assess whether the child has the ability is, we will move maybe a reinforcer, which is something that they want around, and see whether they are able to track it. And if it's a common object, just a normal item that it's not that reinforcing, are they able to also track the item? So other drills that we might practice with the child to increase the ability to scan is to, being able to doing matching trials with them. So we assess for a child of age 2 and above, they should be able to match 8 items in 30 seconds. So that's how we know whether the child has the ability to actually focus on tasks. If they do not have it, then this is something that we are gonna practice with the child so that they can attend and learn better. So the other reason is the lack of cooperation. So this is very common in many children, even children who are neurotypical. So it may start off as something very trivial, just the child not following your instructions, but it can create a much bigger problem next time. So you can imagine that they don't follow instructions, not just with you, but in school, teachers are going to have a hard time to teach them anything. So they're taking the lead all the time, and they only choose what they want to learn. So that's going to limit their learning a lot. So another reason why the child has delayed language, maybe because the child has picked up inappropriate ways to communicate. So maybe they have been reinforced that every time they cry, they will get what they want. So, and every time when they try to get what they want, they will try to hit others by being aggressive, and eventually they will get what they want. So this is something that we need to correct. When they are not using proper ways to communicate, we don't reinforce the behavior, and then we teach them what's the right way to communicate their wants, which is to ask nicely. So another reason why a child may not be using language properly is maybe due to their weak oromotor coordination. So sometimes it's because they are born with very weak oral muscles. They are not able to control their oral muscles very well to produce words, to actually articulate words properly. So it might be also due to the fact that maybe in the first few years of their life, they have not been speaking much. So they have not been using their oral muscles, and their muscles will become stiff because they haven't been speaking. And that will make it difficult for us to actually teach them words as well. So that's why usually interventions start early, because we want to prevent them. This is one of the reasons we want to prevent their oral muscles from stiffening. So the other reason that might lead to speech delays is that when they're exposed to more than one language. So although commonly we have heard before that in order to teach a child more than one language, we have to start from young. So that applies to neurotypical children, but not all children can learn very well in that way. So children with autism, they learn things in a very explicit way and very precise way. So when they're exposed to one language, for example, Mandarin and English, there are more than one word that has the same meaning. So to them, it may be confusing, and they might not want to learn it at all. So if your child is having this issue and you're speaking more than one language with your child, it will be good to start off to focus on just picking up one language. So once that the child has mastered one language, then we can move on to the second one. Stimming. So stimming is a self-regulatory behavior. So it's a repetitive behavior whereby a child repeatedly do something in order to make himself feel better. So it's usually due to either a too little stimulation, and that's why they are trying to give themselves more stimulation, or too much stimulation, so they are trying to relieve themselves. So you can think of it in a way that it's like when we have been out working for the entire day, sometimes we come home feeling very overwhelmed. So for them, they have a different tolerance level. So kind of it's the same kind of feeling, but they tend to feel overwhelmed much more easier than us. So why is it important to know? Because if we are able to identify that they're actually trying to regulate themselves, then and sometimes we try not to stop them, because if stopping them, we might be causing more stress to them, and then it might lead to more behaviors such as tantrum and meltdowns. So let me move on to the next slide first. So these are some stimming behaviors. So usually if it's due to overstimulation, the child might be flapping their hands. So For example, so usually there's a trigger. For example, watching videos, favorite videos, it makes them really excited, and the way they relieve this excitement is to flap their hands. So for neurotypical children, we might verbalize it. We might, we might be saying yay and all that. So for them, this is their way of expressing their excitement. They might be also be, jumping and running around. They might be flickering their eyes as well. So flickering of eyes, it can be also due to, too much information. So information can take place, not just visual information, it can also be auditory information and other forms of information. So it's also very common that sometimes in the session, towards the last, so for children with sensory issues, towards the last 30 minutes, a child might start flickering their eyes, showing that, there's too much information and I need a break. So if let's say we understand that this is what they're trying to communicate, then we will be able to, provide them what they want. So usually in a session, if this occurs, we will give the child a break. And then we know that we know how to prevent and kind of know that, okay, before the child starts feeling overwhelmed, we should be giving the child a break. So it can be hitting the head or hitting the jaw as well. So that kind of make them feel better. So it is very similar to, sometimes even for us, when you're very, very angry, we just feel like, punching a bag. So it's the same for them. And then it can also be due to a lack of stimulation. So the first behavior is tiptoeing. So children with autism, sometimes they tiptoe a lot. That's because they want more stimulation in their souls. So some of the things that we can do to actually help them is to massage their soul. So we provide the stimulation in another way so that they has less need to tiptoe. Self-injurious behaviors such as biting nails, and some individuals with autism, they actually like to peel themselves, scratch themselves, and hurt themselves in a way because they kind of want to feel the stimulation. So what we should do instead of just stopping them is to actually teach them, teach them other ways of giving themselves that form of stimulation. It can be in the form of massage usually. And then looking at spinning objects. So this is more of a visual stim. So so sometimes so you might see a child going near the fan or going near the washing machine, and they feel good when they look at it. So the movement of something spinning or even a top. And then repeating certain parts of the song again and again. So that will be more of an auditory stim. Actually stims comes in different form. It can be auditory, it can be visual, it can be tactile, it can be vestibular. So vestibular is more of like, moving the body to regulate themselves. So in a form of like jumping and running, flapping of hands, and rocking on the chair. So moving on to the next one will be echolalia, which is really common as well. So what is echolalia? So echolalia is a behavior whereby the child repeats what you say, or he or she repeats what's being heard. So why is it important to understand? Because if you understand why they engage in that behavior, you might realize that it's not such a bad thing most of the time, and we might not need to worry so much about it. So some possible reasons. So there are two main reasons actually. So the first one would be they have difficulty understanding what you say. So instead of saying, I don't know, which neurotypical children will say, I don't know, I don't understand. Their way of communicating, I don't know, is to repeat your instructions. So, and then the other reason why they repeat what you say is that it helps them process the information properly. So they kind of need to repeat it to themselves to process it, which some of us do that as well. I personally also do that sometimes. If I need to understand something better, I will read it again to myself. So it's the same for them. So what can we do to help to reduce this behavior? Because it can be disruptive, right? It can be strange as well if they do it too much. So so firstly, we can improve their receptive skills. So receptive skills means their understanding of commands and instructions. So in a session at Healis, what we do is that we will train them to follow instructions and reinforce that response according to a certain instruction. So so by improving their receptive skills with all those drills, it's also training their brains to process information better, like in a way that we do. So another thing that we can do is to teach the child to say, I don't know, or I don't understand. So sometimes it's just that, you know, they don't know that they're supposed to say that when they don't understand something. So all these can be taught. Repetitive behavior. So what is repetitive behavior? So it just refers to a child, you know, like repeating a behavior again and again. So it might be playing with the same toy again, spinning the wheels again and again, or it might be also in a form of stimming, which I talked about just now. So but sometimes it's not due to stimming. So repetitive behaviors can refer to stimming, whereby they repeat a behavior to make themselves feel better, but sometimes it's not. So it's important to know, because you know, the same behavior might play a different function. So if it's due to a different function, a different intention, then we intervene it differently. So what are the other possible reasons? The first one is they're just very interested in something. And children with autism, when they're interested, when they like something for a very, very long time, which is not a bad thing. It can be an advantage, actually. So so that's something. So I think what we should do is to educate them in terms of like, when is it the right time to engage or in that behavior, if it's just a hobby or interest. So for example, when people are around, you know, it's only polite, you know, to be present and to be interacting with others and not engaging in their hobby. So I think the problem is not their great interest, is that they don't understand like some of the they are lacking some of the social skills, and they don't understand some of the social concepts and expectations. So instead of stopping them in engaging in their interests, what we should do is to educate them when is it appropriate to do so. So of course, it's also sometimes they repeat a behavior because it makes them feel good. So that would be stimming, which we talked about just now. So another reason why they keep doing the same thing is that they have not explored other ways of playing. So children with autism, they tend to like to stick to the same thing. They're afraid of new things and changes. So sometimes it's not that they're not gonna like it, but they are just not exposed to it. So one of the solutions is to expose children with autism to more new ways of playing. So we demonstrate to them like how to play with a toy differently, and then reinforce them when they are following us to do it. And also introducing them to new places and environments. So in a way that we are introducing changes and new things in their life gradually. This is going to help them be more open to changes in general. So the last one will be being rigid. So what do you mean by being rigid? So it means like, you know, they stick to the same thing. So so this is referring to, for example, same routines, same food, right? They only eat the same kind of food, and they only follow instructions to the same people, or you know, like they're always in the same environment, and they refuse to explore new environments. So why is this important to know? Because some of these rigid behaviors can be very detrimental to their learning and daily functioning in the long run. So like, for example, pickiness with food. So this directly gonna affect like how much nutrients and the type of nutrients that a child can get from his diet. So if we are able to identify and correct this behavior early and prepare them, more like expose them to changes early, so we prepare them early for it. So it will be easier when we start early. So yeah, what are some of the possible reasons why a child is so rigid and stick to the same thing? Because by keeping things the same, it gives them a more sense of control. So it feels more familiar. So that will, as a result, give them more sense of security. So another reason why that they are rigid is they are taught to be rigid. So I think this is where we need to be more mindful in a way, like are we actually reinforcing their rigid behaviors? For example, certain routines. So at the start, routines and repetitions are beneficial because it helps them learn better. But once they have learned it, it's good for us to start introducing like changes. Even for routines, right? We can introduce like small changes to it, as simple as taking a different seat for breakfast. It can be as simple as the child likes to eat poke snack, but this time a different flavor. So all these little changes, we try to like incorporate as much as possible in their life. So that will prevent them from being rigid. So another way to actually reduce their rigid behavior is to increase their waiting tolerance. So teaching them to be more patient. So one way is to so they always expect something. They have expectations. So a rigid child, usually they have expectations and they expect their expectations to be met. So we kind of need to correct this. We need to teach them to delay gratification. So in a session, what we might do is that we can contrive situations where the child does not get the reward or the reinforcement immediately as he always did. So the therapist might pretend to be busy and require the child to wait. Like, oh, hold on a moment. Let me do this first. Let me do this first. So we are kind of like, not setting the expectation for the child that, once you finish your task, you're gonna get a reward immediately. So that's how we actually introduce little changes and teach the child to delay gratification. So, and the child also learns to wait. So this is very beneficial, especially in school. If let's say they're expected to wait longer during transition from one period to another, they won't get upset. So this will conclude the end of my presentation, and I hope that my presentation helps in your understanding of some of these signs. So now it's Q&A time. Do type your questions in the chat box and we'll try to address as many as possible.
Thank you, Yi Zhuang, for that very informative presentation. We will now move into the Q&A segment. So to ask a question, you may click on the Q&A tool found below. You may key in your questions, which can be viewed by other participants as well. Given the time constraints, we will likely not be able to address all the questions, but do be rest assured that our speakers will do their best to answer as many questions as they can. Moving on to the first question. So the first one is, are there any methods to improve oral motor coordination, or can this only be helped by speech therapists?
So there are simple ways to do it, but it depends on your child. So what is the reason why they are not why they're having stiff muscles or weak muscles? So a few ways. So the first one would be oral massage. So behavior therapies, we do know like oral massage as well. So massaging the lips, around the lips, that will help stimulate their muscles. If let's say, they have ability controlling their muscles. So another way, if let's say, if it's due to also like an imitation problem, so their ability to actually imitate lip movements, what we can do is we conduct echoic training. So whereby we teach them to repeat words. So and we practice with them intensively. So usually in a session, to make this more effective and to motivate the child, we do this during NAND training, which is where we have a reinforcer and the child's supposed to request for it. So during NAND training, the child really, really wants the item in your hand. So that's where we can get the child to repeat like the label of the item. So that's how we incorporate like echoic training. So the other way is also like to kind of embed like oral imitation in other imitation drills, like doing because gross motor imitation will be easier than echoics, imitation of lip movements and vocal imitation. So we kind of like embed it in like imitation. For example, let's do this. Let's touch it. Let's touch lips, and can you say ah? So these are just some of the drills that we practice with the child to improve their oral imitation or vocal imitation.
So I guess you can say that it depends on the root problem for the oral motor coordination.
Yes, that's right. So if let's say it's good to actually seek opinion from a speech therapist as well, if not a speech pathologist. So from there, I think they can make a recommendation. They can advise in a way that what's required. Is this an oral muscle issue? Is it really that because the child cannot control the muscles, or is it due to other reasons?
All right. Okay. Moving on to the next question. Hi, I have a question. I heard that the reason for eye contact can be sensory overload. How do we overcome that?
Let me try to rephrase the question. Not sure if I understand the question properly. So in a way that I think sometimes they avoid eye contact because they're having sensory overload. That's why they avoid eye contact. So I think if I'm not wrong, I assume that the question is asked in that way. So actually for eye contact wise, same thing, we make sure that we teach the child when the child is kind of available. So in a way that when we try to increase eye contact, we don't force the child in any way. So we don't try to stress the child. So only when the child is calm and the child wants something from you, for example. So having a reinforcer there and knowing the child that he is calm and not having any sensory overload. Usually when that's the case, there'll be no problem increasing the eye contact. So the child actually wants the reinforcer, and then they will look at you naturally. So unconsciously, I think, so the child doesn't even know that you're getting them to look at you. So you're just making use of that reinforcer to kind of get their attention, but because it's close to your face and eyes, they naturally associate that with that reinforcer. So unconsciously, they will start to find your eyes as reinforcing. So if you start this at a young age, usually they will not be overstimulated when looking at your eyes. So overstimulation most often is not really because they're looking at your eyes and they get overstimulated. And usually sometimes eye contact, we don't require them to like look intensely for a long time. It's actually just a brief moment. Yeah, so that shouldn't cause too much overstimulation. Most of the time it's because they are already overstimulated and we try to get them to look, or like force them to look when they have no motivation to actually look. But if let's say you create the situation whereby the child is motivated to look at you, so using something that they really want, they will find the experience of looking at you as reinforcing. So that's how we increase eye contact in a very stress-free manner.
All right. Okay. Okay, so moving on to the next question. My daughter is tiptoeing, biting nails, and has delayed in language. Is delayed in language. Could you suggest ways to provide her with more stimulation?
Okay, so it depends on how old your child is, because tiptoeing is a common behavior in young toddlers. So so if let's say your child is about 2 years old, if she's still tiptoeing, it might not be a concern yet, but of course we need to observe, and what you can do is to start massaging her feet regularly and see if that helps. And also like maybe when she's tiptoeing, if at around 3 years old your child is still tiptoeing all the time, like it did not reduce, that's where you know, you can start, when you realize that the child's tiptoeing, just exert a little pressure on her when she's tiptoeing, and then kind of praise her, hey, I like that you're walking nicely, and things like that. So but I think it's good to note that most children, like before 2.5 years old, they are tiptoeing. It's really how much they do it and how long they do it for. So most children, they tiptoe a while, then they will walk, and then they will tiptoe a while and they walk. So children with autism, they kind of like they have very stiff muscles, and then they tiptoe all the time. Yeah, then that would be a concern. So another part to the question is delayed speech, right?
Yes.
Yes, so delayed speech, it would be good if you know, you can have an assessment with a professional, because like during my presentation just now, delayed in speech can be due to many different reasons. So according to what your child is lacking, for example, if let's say it's a visual issue, like if your child is also not being able to attend to tasks or attend to something for a very long time, or you know, not able to match items like what I said, then it might be actually a visual problem. So we might need to increase the ability to scan and track and focus on tasks to help with her speech. So then it can be also due to like a lack of cooperation. Then if it's a lack of cooperation, then the way we handle it will be different. Then we will try to increase the level of cooperation. So it's good to actually have an assessment first to assess the different areas of skills, what she's lacking in, and we will try to improve on all those areas, and that will help with her speech.
So if I understand correctly, what you're saying is that the things that you have presented are the autism signs, but it's best to go get a thorough assessment to really identify what are the main causes, so that the therapist can provide the proper treatment. Is that correct?
Yes, that's right. So I think also understanding is a way to help you feel less frustration as a caregiver. So as a caregiver, like because if you don't understand why they're engaging in such behavior, it can be very, very frustrating. So when you're frustrated, you kind of like vent it also as or project your feelings on the child as well. So so in terms of like if you have any problems with managing your child's behavior, it's good to get a professional who knows how to do it to help you with it. But in a way that understanding it as a caregiver, it kind of help you in a way because you need to become yourself as a caregiver before you can take care of your child. So that will probably be my main objective of like talking about all the symptoms.
All right. Okay, so next question. How do we handle task avoidance?
So task avoidance, it can be due to different reasons as well. So most of the time, it's because it's stressful. So it can be because the task is too difficult, the child struggling with it too much, or the task is too boring, or you know, the child is just or maybe even the child just likes to see you angry. So it can be any of these reasons. So it's good to actually understand like why your child is avoiding the task. So if let's say it's just a particular task that the child's always avoiding, then it means that the task might be too difficult, and you might want to make it easier for the child, or you know, like just make it just a short trial will do. Like not have the child like work on the task for too long. And then once the child completes it, prepare a reward or reinforcer so that the child, you're actually associate the task as something reinforcing. Yeah. So if let's say your child is avoiding like tasks in general, like and on table tasks in general, like one thing that we do is that we can kind of like just get the child to sit on the table, on the chair, at the table with the tasks around him, but not work on the task. So what we are trying to do is that we are trying to prevent the child from predicting that, you know, oh no, my life is going to get worse the moment I see all these things. So the moment I see a teacher or I see mommy or I see like flashcards, my life's going to get worse. I'm going to struggle. So we want to prevent that. But what we are trying to do is we want the child, every time they see these materials, they are gonna like it. They're gonna expect, oh, you know, after finishing this, I'm gonna have this. After finishing this, I'm gonna play with the toy. So in this way, then we are trying to motivate the child to learn.
Okay, next question. My child is turning 11. Is it too late to start developing some of his skills? What are the difficulties when you start picking up skills at a later age?
Yeah. Okay. So when you start at a later age, definitely seeing results is gonna be slower. So to be honest, it's gonna be more challenging. But I don't think we should give up at any time. So there's always hope. There are cases where, you know, they only started picking up skills, you know, in their 20s. So anything is possible, I think. But of course, don't try to do it alone. It's really good to seek professional advice and seek help, because they have been trained to do this and they'll probably know much better. So don't do this alone. It's going to be very, very challenging. So get someone to help and seek their advice. What's the next step that we can do? So personally, I do also have a client who I've met at 9 years old, entirely nonverbal as well. So although the results are very slow, but after 2 years now, she's able to mend, I want something. So at least she can communicate and there's progress. So even if the progress is slow and compared to others, I think it's better than having no progress at all.
That's true. Okay. Okay. Okay, that's the bell. All right, so due to time constraints, we will take the last question. Okay, so the last question is, Hi, Yi Zhuang. I have a question about learning more than one language at a time. My wife only speaks Mandarin, and I can communicate in both English and Mandarin. Would it be better for us to teach my son Mandarin? The preschool he is attending communicates in English. So what should we do in terms of schooling?
So what I suggest is because in Singapore, if let's say you're gonna stay in Singapore long term and the child's gonna study in Singapore, the language that's being used more commonly will be English. So in order to make sure that, you know, the child is speaking the language that is more functional, like he gets to use it. So imagine he goes out next time to school in public. What is the language that might benefit him the most? So although at home maybe the language being used is Mandarin, but I would feel that it's easier to teach the child English, which is the more commonly used language in Singapore, and then perhaps mommy can try to learn just a few words in English. So I think that might be easier than teaching the child Mandarin, and then after that, if like he goes to school, he's still gonna struggle, and most of the time still gonna struggle, and he might be able to only follow mommy's instructions. So I think for long-term benefits, it would be better to teach the child in English, and then maybe mommy to learn a few words in English as well. So simple things like give me, hold on, wait, all that.
All right. Okay, so right now we'll be taking a 5 minutes break. Thank you so much, Yi Zhuang, for answering all those questions.
Thank you.
So we'll take a 5 minutes break. Do some stretches, visit the washroom, or grab some food and drinks if necessary. Do join us again at 11 a.m. See you in 5.
Hi everyone, welcome back. Thank you for staying with us. So without any delay, let's go into our next topic. Let me share the screen. All right. So today I'll be discussing on the 7 crucial skills a child with autism needs to develop on. So I'll be discussing on these 7 skills: mending, receptive language, visual performance, intraverbals, social skills, academics, and self-help skills. I will also be talking about why is it so important to develop these skills as well. So let's jump right into the first one. So first, we're going to start off with mending. So when it comes to mending, what is mending? Sorry? Yeah. All right. What is mending? Mending is basically when the child is able to ask for something he or she wants. It is important as it allows the child to have access to any specific items, activities, or even the actions. For example, like jumping, or maybe going out for shopping, or maybe I want to play with the red ball. These are things like activities and items and actions that we talk about. Now, through mending, what are the behaviors that we want to increase? Basically, what we want is that we want the child to be able to respond to the question of, what do you want? Because these are the usual questions that anyone asks, whether it's a parent or whether it's the teachers and all. These are the questions that they usually ask. Also, spontaneous mending. For example, when I ask the child, what do you want? When the item or the activity is not present in the environment that they are in right now. So for example, maybe they want a cookie that's in the kitchen, but they are in the living room. So when I ask them, so what do you want? For them to be able to respond, I want the cookie. These are the kind of behaviors that we want to increase in spontaneous mending. Next, we have social interactions. So for social interactions, we want it to develop in a sense of like for asking help during difficult tasks or requesting for missing items. For example, I've given the child a task of a worksheet, but there's no pencil available there. So I would like the child to mend and request from me, Miss Kara, may I have the pencil, please? These are the kind of mending that we are working on as well. And then next, what are the behaviors that we want to decrease through mending? Because as we develop mending, these are the behaviors that will decrease, which are the inappropriate behaviors such as crying, stimming, or maybe some aggression as well. Because usually children with autism, they go through these inappropriate behaviors in a way of communication because they don't know how to mend. So as we increase the mending skill set, these inappropriate behaviors will decrease. Next, we are going to look at receptive language. So what is this term? I'm sure you've heard from your therapist or the teachers that work with your children use this term called receptive language. Receptive language is basically the ability to understand words and language. The importance of it, to be able to communicate with others and to also be able to understand and follow through given instructions such as, hey, let's color the circle blue, or could you give me the red ball? These are instructions that usually are given in a home setting or even in a school setting as well. So we would like to see our children be able to understand this kind of instructions given. All right, so what are the kind of behaviors that we want to increase through learning receptive language? We want them to have the understanding and the following of instructions given to them, to follow rules in a natural setting, such as in a school or even in public place. For example, no shouting in the library. So the child has to have the receptive language to understand the rule, no shouting in the library. Next, we also want to increase the understanding of safety behaviors because safety is very important. For example, when you see a traffic light, when you're at the traffic light, you see the brake man, and the child is supposed to understand stop. And when the parent says stop, let's wait, the child needs to understand this receptive language for them to follow through with the instruction given as well. And through receptive language, we also are able to decrease the inappropriate behaviors as stated before, such as crying, stimming, or the aggressive behaviors. Next, we are going to look at visual performance. So what is visual performance? It is actually the brain's ability to understand what is perceived by the eyes. Good visual perception is important because it is an essential skill to learn such different skill sets such as imitation, speech, and also social awareness. So for visual performance, as we are teaching visual performance to the child, these are the behaviors that we want to increase. Firstly, we want the child to be able to discriminate not only objects, but people as well, teachers, parents, brothers, grandparents. Next, we also want them to be able to have sustained attention and focus during tasks given to them. Also, we want to work on spatial orientation, whether it's with reading, writing, or even navigation around them, spatial awareness. And of course, the most important thing, eye contact. We also want them to have the eye contact because through all of these behaviors being increased, the skill sets such as imitation of actions, speech, and social awareness will progress and follow through as well. Next, we're going to look at intraverbals. So what is intraverbals? It is a skill set that requires the child to be able to explain, discuss, and also describe what is happening at that point of time, or what is happening without the visual motivation or the visual prompt there. For example, a lot of parents and teachers will ask, "What do you do at school today?" And a lot of children with autism are not able to respond properly. Sometimes they repeat the question again because they don't know, like Yi Zhuang said just now, Echolalia, because they don't know how to answer the question. So we want to work on intraverbals, which will help in our daily social communication. So we want to increase behaviors such as providing social communication for 2 or more people, and also giving personal information such as name, address, birthday, things done for the day, and vice versa. We want them to be able to ask for questions, ask for information as well, whereby the child will begin interacting with another child, saying, for example, what did you do today? Did you eat your lunch today? So these are the different kind of questions that we want our children to work on as well. We also want to increase the behavior of answering and asking WH questions, which in turn will help with the next skill set that I'm going to discuss on, which is basically social skills. So social skills, it is basically a skill set that enables a child to know how to react to different social settings. It's also very important because it allows the child to understand what is going on around them, the appropriate behaviors for different social settings, the boundaries that they have to have. For example, when a friend is crying, what if the child is laughing? That's not an appropriate behavior. So these are things that we want to work on as well and guide the child with autism to develop this skill set. So what do we want to increase when we're teaching social skills? We want to increase their social awareness, the ability to respond in different social settings, to be able to conduct themselves, as stated before, knowing boundaries, waiting for their turn to speak, and also we want them to increase their emotional self-regulation as well. Now, the lack of social awareness can lead up to unemployment in the future, because I know as parents and caregivers, you are most definitely planning for your child's future. Now, what do I mean by leading up to unemployment? Because social skills is a very important skill set to develop at a young age. As it develops, as it progresses and develops, when you grow older, you are much more sociable. You are able to know how to react in a different social setting. You're able to know when is it right for you to speak, or when it is my turn to keep quiet and listen. So these are things are very important, especially in adulthood as well. Thus, it also can lead up to unemployment. These are the things that I want to explain when I say unemployment as well. Next, we are going to look at academics. So academics is a skills that that we have to develop on because it includes both literacy and numeracy skill set. Children have a certain milestone to hit based on their age and their level of IQ as well. So children with autism, usually they have a difficulty in attaining that. Hence, we need to help them develop it. So the behaviors that we want to increase when we are doing academic skills is more on generalizing the functional skills that we've taught them in a one-to-one setting to a regular setting, like in school or in public as well. So for example, during a one-to-one setting, you're teaching the child time telling, money skills as well, and maybe reading books. But then in a generalized setting, how will the child follow through? So during academics, this is how we can assess as well. For example, money skills is when during recess time, they go to the canteen, buying food, waiting for their change, getting the correct change. These are things that we want them to learn as well. And also, for example, telling time. So when you're at school, first period is over, what's next? And what time is the next period? These are the kind of skills that we want to work on and increase on their behavior as well. And also, most definitely increase their self-esteem and self-worth as well. Knowing that, hey, today I was able to finish up my homework. Today I was able to ask a question. So in a very generalized, natural setting, we want to develop these academic skills. And it also helps to increase the curiosity within the child themselves. Because as children, we want them to be more curious in asking questions, to be more forthcoming. Yeah. And next, we're going to look at the final crucial skill. This is something that some of us may actually forget to work on, which is self-help skills, like more towards independent living. So let's look at what we have for self-help skills. All right, so for self-help skills, it includes things such as dressing, eating, drinking, toileting, and personal grooming. These are the some examples of self-help skills. Now, why are these so important? Because when your child, even though your child is young, we want them to be able to function independently at home or at school or even at work in the future. So what are the different kind of behaviors that we want to increase during teaching self-help skills? We want them to be functionally independent and to increase their self-esteem that, hey, I'm able to put my clothes on today. Hey, I'm able to carry my bag and go to school on my own today. So it really increases their self-worth and also their confidence level as well. Now, with all of the 7 skills that I've discussed today, it is important that we remind ourselves that the early intervention, it really helps them to achieve their milestones, and it will also have a lasting legacy effect on our child's lifetime as well. Because as much as we develop the child's important skills at this young age, it will really help them throughout in their entire lifetime. So thank you for the time today. We can go on to our Q&A session now.
All right. Thank you, Kara, for that very informative presentation. Okay, now we're moving on to the Q&A segment. To ask a question, you may click on the Q&A toolbox below, or you may key in your questions, which can be viewed by other participants. Once again, given time constraints, you'll likely not be able to address all of them, but we'll try our best. Okay, but before that, we have someone who raised their hand. Is it Gerald? Would you like to ask a question by yourself? You can unmute yourself now. Okay, if not, I'll move on to the next person, which is Ma Chung Wei. So Ma Chung Wei also raised their hand. All right. Ma Chung Wei, you may ask your question. If not, we'll just move on to the Q&A segment. All right. So, all right. So the first question is, would exposing my child to other children her age help develop some of these skills?
Okay, so for me, I would say that's a definite yes, because children generally they learn through imitation as well. So I would encourage parents and caregivers to do more play dates as well, so that it really helps with their children in developing and imitating the appropriate behaviors and the appropriate skill sets as well. And also at the same time, it also helps with inclusion as well, personally, from my take, whether a neurotypical kid, whether it's the cousin or a friend, being able to adapt and adjust to a child with autism as well, and also guide them in learning and teaching the skill set.
So just to add on in that aspect, would you say that it'll be good to for these kids to learn, would it be possible for these kids to learn these skills in government schools, mainstream schools I mean, than special schools, things like that?
I would say it depends on the level of the child as well, whether the child is able to adapt into a mainstream setting, or they really need the special school setting, which is more towards those children with more sensory needs. So it really depends, but I feel that personally on caregivers and parents, they can bring their kids out on their own for, like I said, play dates, or meeting up other parents with special needs children or even neurotypical children as well, to get them to learn and adapt into different social skill setting in learning, and also learning different skills like maybe requesting, or maybe visual performance, like more towards eye contact and all. Yeah.
Okay, so next question. I find that my child seems to be uninterested in any positive hobbies, academics, reading, outdoors, etc. He is always obsessed with some cartoons and games, including their songs, sound effects, and background music. How do we divert his attention to something more conducive towards his future development?
Okay, so I think given the age and time, we're all very savvy, and most of our children are quite into their songs, videos and all. So usually how I would maybe redirect it is getting them, like if it's with cartoons, I would suggest maybe trying out like drawing art as well. So you can introduce art lessons which teach you how to draw cartoons, and then teach them the process of how they make cartoons as well. So it's a bit more appropriate in a sense that they learn different skill sets such as drawing, coloring, and maybe they might find an interest in that as well, for example, with regards to cartoons. And maybe with songs, what I can suggest is maybe instead of listening to watching video songs, we can introduce musical instruments as well, so that you can introduce different kind of hobbies, like maybe learning how to play the music, or maybe writing a song. These are different things that you can introduce. So it doesn't always have to be a video setting or a song setting. So you can slowly introduce this kind of different activities that may develop into a hobby as well.
To link to their current interests, is that correct? To like make it easier. All right.
Yeah, so the transition should be easier for them.
Okay, next question. What if my child is not interested in interacting with children her age? How should I develop her social skills?
Maybe what I can suggest is starting out in a home setting as well. So in a home setting, we can introduce more social setting, like maybe showing social stories, um, introducing maybe like family members, like cousins around the same age as well, and then trying it in a home setting first before trying to adapt to in a school setting, because a school setting in that environment can be quite daunting towards a child with special needs. So maybe we can try it in a home setting first. You can also suggest, what I can suggest is that we can ask teachers or therapists. Usually what they would do is that they would create social scenarios within the home-based setting to guide and develop social skills for the child.
Okay, next question. My son never plays with any toys. He would prefer climbing, iPad, or reading. Is it possible for kids to really not like toys, or perhaps I didn't expose him enough?
Okay, so for children with special needs, especially autism, right? Every child is very different. This is something that I would like to reiterate every time. So every child has different interests. Sometimes there are children who are not interested in toys. Maybe it doesn't give them the particular stimulation that they like, or the particular excitement that they would want to have. So if he prefers climbing, maybe what I would suggest is more physical based activities, like outdoor activities. That would be quite exciting for the child. And it would be also better because it's more of a natural setting, in a sense that not being too engrossed with a toy, but going into the outside world, and going into a social setting, going for maybe rock climbing, or maybe just going to the park to play with the monkey bars. You're creating a social setting on your own already. So I think it is okay if your child is not so comfortable with playing with toys. You can still expose toys to them, but it is at the end of the day your son's choice whether he finds it stimulating enough for him or not.
Okay, next question. Okay, so with regards to your presentation, you actually provided us a whole range of crucial skills, right? So one question is, which one of these skills needs to be developed first?
First of all would be mending, so more on requesting, letting the whoever it is, whether a parent, teacher, or caregiver, know what the child actually wants or needs. So I think that's a very important skill set to have first before we move on into other different skill sets.
Okay, next question. How do I encourage my child to write?
Okay, I think when it comes to writing, a lot of children with autism, they tend to avoid it because it's a very sometimes it's a difficult task for them to do, because it includes a lot of different skill set, joint attention, holding the pencil, focusing on the word, and copying the word itself. It's a lot for a child with special needs. So you can introduce different ways of writing before using the pencil itself. You can use maybe using, I would suggest maybe sand or maybe beads. You can do a sensory-based writing activity. I can suggest that. And then moving on to slowly holding markers, big size markers like jumbo markers, and then writing on whiteboard first. And then moving on to maybe giving a pencil, and then trying it out. So there's a slow transition. Hence the child isn't so stressed out in the start already with doing something too difficult for them.
Alright. Okay, so that's all for the questions for Kara. Maybe we could bring back Yi Zhuang to answer the questions that were left over just now.
Yep, sure.
Oh, we have, okay. Okay, so I'll just ask the questions. So the first one was, at what age can we consider a child having delayed language?
So there are different like milestones that a child should meet at different age. So but it's kind of like changing. I think children these days are learning words much earlier than before. So I think a rough gauge will be, for example, for a child at 2 years old, the child should have should be able to label about 200 nouns. So at the age of 3, it should be about 300 to 400 nouns. So nouns, I mean common things that we see. It can be fruits, it can be toys, so that they should be able to label when you ask them. So if a child is not able to label any of these at this age, then I think definitely then there are some delays. So of course, there are also another case whereby the child's able to label, but the child doesn't use it to communicate. So if you see that, that is also a form of like a delay in terms of like communication skills. So if the child is able to label everything, for example, he's able to label milk, but whenever he wants milk, he doesn't use it to communicate that I want milk. So although he knows the words "I want milk," but he never ever used it to communicate, then that will be a delay in communication skills. So that's where you will need to seek perhaps seek advice from professionals, and then maybe intervention as well.
Okay, so next question. My son is at the stage which he doesn't know how to initiate play with other kids. So he always hit other kids to get attention. What should I do? If my son keeps doing Echolalia, and as you mentioned, this actually means he doesn't understand. Shall I stop teaching him that? How do I teach him new sentences? Okay, I think there are 2 parts to this question.
Yes.
I'll rephrase the first one, which is he doesn't know how to initiate play, but pushes and hits the kids. So what can we teach the kids?
So I think based on this description, there might be a few behaviors happening here. So firstly, it seems like the child is not very cooperative as well. So I think that will be the first behavior that we need to tackle. So getting the child to be able to follow instructions. Not just with the teachers, but also with caregivers at home. So mainly not to reinforce any behavior such as hitting. So if let's say you're saying that he's hitting others for attention, what we can do, because it's harder to control in a school environment. So, but at home, what we can start doing is, if he has displayed any this kind of attention, behavior to get attention, what we do is we don't attend to him. So even saying that no, you don't hit is a form of attention. It's a form of negative attention, which might be reinforcing the behavior. So so in a way that we can block his hitting if he's hitting you. So block it, but don't get angry or don't say anything. So once it's calm, we praise him for being calm. So what we are trying to do here is, instead of attending to the undesirable behaviors, we kind of create opportunities for the child to engage in engage in a desirable behavior, and then we reinforce it. Yeah. So and then so when talking about social skills, there's also another reason why a child is not communicating well. Maybe the child does not have mending skills yet, which is requesting, right? So simple things like in a one-on-one session, what we try to teach the child first is to mend for example, missing items, mend for information, mend for attention, mend for help. So things like, if when he needs help, does he say, help me? So when he wants someone's attention, does he, with the therapist or in a one-on-one session with the instructor, say, look, hey, or address the person by name? If he's not able to do it in a one-on-one setting, then in a school environment with a peer, definitely he won't be able to ask that, because that's a requirement for that. So the child needs to understand that he needs to communicate like help, teacher Kara, or daddy or mommy. So if he's not able to get attention properly, then he won't be able to get attention from his peers properly. So that's where he might resort to hitting or other behaviors to actually get their attention. So so there are also many other reasons why a child might be having that issue. So I think it will be good to also seek help from a teacher that understands the child very well to have more information on that. Yeah. So what's the second part of the question?
So the second part is, if my son keeps doing Echolalia, and as you mentioned, this actually means he doesn't understand, shall I stop teaching him that? How do I teach him new sentences which are not nouns?
Okay, so for the echolalia part, if let's say the child doesn't understand, what we teach is to teach the child to say I don't know. So if in any case, one part is we teach the child I don't know. So it depending on the level of the child. Then another way is to actually just provide the child with the answer right after your question. So for example, you know that the child wants milk, but the child always, if you ask the child, what do you want? And he always say, what do you want? But you know that at that moment, every time in this situation, he wants milk. So what we can do is like, firstly, you can say, what do you want? Milk. So you just give the answer. So the child usually will say milk. Good saying milk. And then if this doesn't work, you might want to stop asking the question entirely and just get the child to visually associate the item that he wants and like the verbal response that he's supposed to give. So we start from mending. So in order to deal with echolalia, like another way is also like we start from mending. Just visually present the item that he wants. So where the motivation is high to ask for it, and then entirely scrape off asking the question at the start. So that we can stop the child from engaging in repeating your answer and repeating your question. So every time he sees the milk, then he's supposed to say milk and then you give it to him. Every time he sees car, he's supposed to say car and then you give it to him. So naturally after that, the child, if he wants something, he sees it, he will name it. And then that's where if he's already doing that consistently, he picks up the ability to label the item that he wants. That's where you can start teaching him the question. Yeah, so I mean, it can be very complicated. So that's why usually we will encourage to get a professional to help, because they are trained to do this as well. They are able to analyze the behaviors and understand at what level the child is and what kind of intervention is appropriate. So, and the other part of the question is the last part.
How do I teach him new sentences which are not nouns?
New sentence. I see. Okay, so that will be an even more advanced level. So that's why if let's say the child still not able to use the nouns functionally, we usually don't go on to teach other words that are not nouns. So which is all the the connectors and everything, is, are, pronouns and all this. We don't move on to the next level because firstly it's gonna stress him out, and then secondly, even if he picks it up, he might not be learning it properly. He might be just memorizing. So we might be teaching the wrong things. So it's good to like assess the different levels and make sure that we are teaching him at his present level, and not and not like way too advanced. So that might stress him out, and he might not want to learn entirely.
Okay. So next question. Is there any possibility that the signs of autism mentioned in the lecture will be resolved with proper therapy when they grow up?
Yes, actually it's possible, especially if you start young. So although like autism, it will follow you throughout your life. So autism, once you have it, it's a bit like, if you're born introverted, you may learn how to socialize with others, reach out to others, learn how to be more extroverted, but you will always you're always an introvert. So it's just that you learn how to function, like you learn how to, you pick up other skills that is gonna be helpful to you. So as the same thing applies to like all these signs associated with autism. So it's mainly to educate the child how to cope with it. So they might be able to overcome all these signs on their own. But for example, there are certain needs that they require. So the sensory part, because autism it affects the way they process information. So if let's say they just get overwhelmed very easily. So this is still a need that might accompany them for their life. But if let's say they already know how to cope with it, then they know exactly when to, take a break before they, have a meltdown. So I think the goal will be mainly to teach them how to cope with all these signs, all these symptoms.
Okay, thank you, Yi Zhuang. We actually have 3 more questions for Kara. So we'll move back to Kara. So with regards to mending, language delay must be addressed first, correct?
With regards to mending, why did I say mending is something that we teach first? So usually with regards to our therapy sessions, what we do is that when we ask the child to mend, it doesn't mean using the words first at all. It can be just showing give, it can be just showing I want, tapping themselves and showing give, I want. And then slowly we start to develop words. So usually when the child shows give, let's say it's a ball, we pair the word ball. Here you go, ball. And that's how we usually introduce the language development as well. So throughout the process, while the child is learning to show give, the child will spontaneously, naturally it will come through. The child will suddenly say "b," or might spontaneously one day might say ball. And that's how we increase the mending as well, for with regards to mending. And that's how we also include language development through mending as well.
So, with regards to mending, it's not just about language capabilities, but other non-verbals, is that correct? That can be used?
It's a gestural prompt as well. So that's a form of communication as well, and we accept that.
Okay, next question. Will PECs cause delay in verbal communication?
So personally, I've seen PECs. I have learned the step-by-step PEC process as well. So usually it's the picture first, and then we introduce the sentence structure as well to them. So what do we do with that? I don't think it delays. We should always pair it with the verbal feedback as well. So when we are always talking about when the child gives the picture ball, we always pair it with the word ball. So we introduce it there, we narrate it there, and we also give the opportunity for the child to try and say the words as well. So we always support that whatever different services or strategies that are used, we try to support it as well. So let's say even though it's a picture exchange communication picture, we also introduce the words as well to create opportunities for the child to use the words. So there won't be a delay or a negative result to using text as well.
Alright. Okay, so moving on to our last question. What would be a good replacement for stimming behavior of clapping?
For clap, I think this is more towards the was it the stimming behaviors with
Yeah.
Yes, okay.
Yeah. So perhaps I can address this. So I think clapping it also depends on firstly we need to observe like in what kind of situation will the child always engage in clapping. So from there we can kind of have an idea like oh, what's the intention? Is it for stimulation or is it like to relieve excitement? So for example, like what's more common is that a child will clap when he's watching video. That means there's actually a source. So is the child always clapping when he gets excited, like watching a video? So that's where you might want to reduce the source. So you might want to remove the source entirely so that it doesn't, overwhelm the child such that the child needs to clap. Yeah. So and also teaching the child, if let's say that's the reason why the child is clapping, also teaching the child to express his excitement in other ways. Simple things like oh yay, or even narrating about commenting on the video. That's gonna help if let's say the child's verbal, or if the child's not verbal, what we can do is to remove and to make sure that so the child can still watch the video but not to the extent that he's gonna clap the hands. And of course we there are more behavioral interventions that we do as well to kind of like correct that behavior. Simple things like whenever he's watching the video, we kind of like gently maybe just get him to have hands quiet and prepare a reinforcer. So we might start off like with just 10 seconds of watching the video without engaging that behavior, and it reinforced him for that. So his motivation to not clap during a video that usually trigger that clapping, right? It's higher now. So he rather not clap right now. And then unconsciously over time, even without a reinforcer, he will watch the video quietly. So of course, if it's verbal, then there's many other things that we can do to help overcome this behavior. So I mean, for clapping, most of the time there's a source, like and it's due to excitement. So they are trying to like relieve it. So when they watch a video, they will like be very excited and they clap very hard. Yeah. So that's how we usually try to overcome it.
All right. Okay, so that's the end. Thank you so much, Yi Zhuang and Kara, for answering all those questions.
Thank you.
I think in what I can say in general is that both of you emphasize the importance of a lot of grading, like introducing new things slowly, pace by pace, to not overwhelm the child. And also, if things are a bit too difficult to understand or like tackle, it'll be good to seek professional help from such as people from Healis Autism Center. Yeah, so okay, thank you so much once again.
Thank you.
Thank you so much for taking your time off on a Saturday morning. Here are some links to our social media platforms. So do follow us to receive timely updates for the next event, or drop us an email for any inquiries. This is the last day of the seminar, Empowering with Healis. We hope you have gained much valuable knowledge and have enjoyed yourself today. Here are some upcoming events during September that you and your child or children can participate in together. Look out on our social medias as we'll be releasing more details soon. Before we end off, please tell us to fill a short feedback form by scanning the QR code or clicking on the link that has been sent in the chat box. Hope to see you soon and have a great weekend ahead.